Glyn and I have worked together for several months now, looking at the ways that we can improve quality and take money out of the system at the same time, and there are definitely opportunities to do that. 100,000 days is the number of days we reckon we should be able to give people at home instead of being in hospital over the next 4 years if we do our job right. The most important thing is that we give people the very best care that we can. So if we get people in and out of hospital and prevent them coming to harm, the happy consequence of that is that we'll need less hospital beds. Everyone is faced with the issue about improving care so it's as good as it possibly can be, but at the same time making sure that they use their resource as efficiently as possible.
Given the really hard financial climate that we face both now and over the next few years, it's important that we can come up with a longer term plan that delivers more appropriate care within the resources available. So 100,000 days is about reducing our reliance on hospital inpatient care and at the same time providing good quality care in the community.
Sometimes you do have to spend money to do something that you weren't able to do before, but the most important thing is to make sure that you remove waste from your systems, and that's a definition of quality which involves sometimes spending less money if you take waste out. It's good quality if you stop people coming to harm. Harming people costs money because you have to fix it and put it right. Delivering services slowly costs money because people are waiting around for things to happen. And that kind of improvement is something that should save money and it should improve quality at the same time.
The opportunities are there to provide good quality healthcare services across community and hospital environments, which means we can avoid patients very often having to come into hospital, or making sure that their hospital stay is appropriately shorter and that they're able to recover at home. And that in turn then will actually help us reduce the cost of inpatient care.
Nobody likes to be in hospital long anyway, do they? So I think it's marvellous that they can do things now that you aren't going to stay in, and the recovery's better anyway when you're at home. I think the quicker you go home, the quicker you recover better anyway. But
we've used the idea of Megan to represent a patient who uses our services. Megan could be anyone you know, could be a wife, a mother, a sister, someone who uses our services, and the idea is that we keep Megan at the front of our minds when we're working with clinicians, with managers, with finance teams, so that she's always in the front of our minds and we're using her to design services. We really hope that we can use this kind of a campaign to improve the time that Megan has at home, because at the end of the day the most important thing is that you make the most of the time that you have. Most people would prefer to be happily independent at home rather than in hospital. My experience is that a focus on the patient and what the patient needs and what's best for patients and people who use our services is the best way to bring people together. Bringing people from the finance world and the clinical world together to look at things in the same way is nearly always fruitful, and it should be something that we aim at. There is a danger that you can turn people off by talking about the money, and I know my finance colleagues recognise that as well.
A key part of communication is actually about talking the same language, something that we're not always that good at doing in finance, but actually it's something that we need to concentrate on doing a lot better.
Good practice should help us to save money, there's no doubt about that, and we should always be looking for ways to use our resources wisely.